Hi, everybody. Welcome back to the Healing Point Massage Therapy YouTube channel. My name is Alana, and today I'm chatting with the owner of the Healing Point Massage Therapy Clinic in St. Albert, Lianna. Hi, Lianna.
Hello, how are you, Alana?
I'm wonderful. How are you?
I'm doing very good, thank you.
I'm really excited to talk to you today. I know that you've had a lot of changes going on in your clinic in St. Albert, and I'm so excited to hear about it.
Yes, definitely one great thing about is we have a lot of requests about our hours. Saturday evenings, we have calls every, say 4 p.m. Do you have any availability today? I'm like, okay, we're closing in 30 minutes. Yeah, nothing. So we've decided that starting in May 9th we're gonna open till 8 on Saturdays.
Exciting.
Yeah. Mm-hmm.
So if people are looking for a later massage,
yes,
that's possible.
Yes, yeah. So, and that's also, that's part of the celebration for our 8th anniversary this year. 8th anniversary.
8 years.
Yeah. So,
that's so exciting.
Yeah. So May 1st, 2026. Yeah, 2026 right now. It was, May 2018, just in one small room. And then now it's this. So I can't believe that we're 8 years. And thanks for everyone who supported the Healing Point Massage Therapy since 2018.
That's so exciting. So you started off in one room.
Yes.
And you've grown. So I imagine that you've grown some of your services as well.
Yeah.
What do you have in addition to massage therapy?
Yeah, so because when I was, practicing on my own, I was just doing massage. So then I was finding okay, what else can I do? Because I feel like I can't help them enough. So then while I was starting that on my own, I went to school for a year. So that's 2018 to 2019. So that after I finished the manual osteopathic therapy school in 2019, so that's a year. So that's when we started the 4-room clinic in Liberton Drive in St. Albert. So that's where we get that. We were able to add food therapist and then acupuncturist that time. And then I was practicing osteo where I can get one client a week. I'm so happy because who knows osteo? It's just not known. They're out there, right? So so I was so excited if I get one. And then next week I get 2. And then you got to repeat a little bit. And I asked them, okay, how do you find out? Because how do you find osteo? Because no one talks about it.
So Lianna, I know that you practice osteopathy, but do you have other clinicians in your clinic that provide that service as well?
Yeah, we also have another manual osteopathic therapist in the clinic. His name is Justin Frankson Heron. So he practiced a while back in BC, and then they moved here in Alberta. So he's practicing with me, and it's been and he also does massage and osteo. So
great,
kind of same practice with what I do and stuff. So
from one client a week to having multiple osteopaths must be a great feeling.
Yes, yeah, and decided that I was just gonna practice full on osteo. So because I do enjoy it a lot. So
what's the biggest difference of osteopathy compared to massage? Yeah,
so like I said earlier, when I was practicing massage, and I feel like there's something is missing because they come back with the same symptoms and same thing. And then sometimes they massage something on the leg, and then they see, I can feel that here somewhere in the lower back or somewhere higher in my shoulder while I was working on their foot or on their leg. So I'm like, okay, that's all I know. It's that's not connected. There's no muscle that's connected to each other. Right? So I'm like, how would that be? So then, until you learn more about what osteo can do and how whole body is connected. And then we have one system, and it's all connected. Something is connected to something. Now you kind of understand how I am able to help the client more than just working on massage and releasing the muscles on one area, and kind of looking at the body, how everything is moving.
That's great.
So yeah.
So when a client comes in for a massage, over and over and they're still seeing the same problems crop up, that's when you recommend trying osteopathy.
Yeah, because that means, so it's kind of the same thing that, you're doing something and it's not working. You're stretching, say you're stretching your neck for years doing this and it's still not working. So that means it's not the problem. I mean, is that the main kind of issue, right? So because it's not helping. So it's just telling you, okay, you have to do something else. So yeah, it's the same thing with you keep massaging that muscle, that the muscle is already, the symptoms of the muscle is already end of what your body has gone through, like the compensation. So when you have that muscle pain, your body have gone through a system of compensation for a long time, right? So you want to go back and to, okay, reverse things and okay, where did it actually start, and then find things where restrictions are, and kind of go from there. We never know what we're gonna see on the table, right? And see, okay, I have this pain. Okay, I can't just say, okay, I have tight of this, but I can't just really tell. Okay, you have a tight shoulder, but why is it tight? That's what I wanted to find out. How are you standing? How are you walking? Or, where the rest of your body or your gravity pull, where is it? Are you leaning forward and try to walk? How are you, how are you walking? So it's a lot of things to look at. How are your hip moving and you're walking? Is it just one leg that's kind of working for whole your life, right? You don't know until you someone tell you oh yeah, you're walking just, and then for you it's just a normal, or
Wow. So it's a little bit more investigative, where you have to figure out things.
Yeah, and they said one of my instructor in school said, we're not really fixing. If clients tell me, okay, fix me today, I can't. I'm not fixing things. I'm just kind of, I like what he said about, we're just a kind of a tool to, we're just kind of we're just helping you open your body so that you can heal yourself. It's, we're not the one who's going to fix you, but your body. It is your body, because our body have the ability to heal on its own.
Right.
But then when everything is out or stuck somewhere, or the nerve is not moving well, the blood flow is stuck somewhere, clavicle, there's a lot there. That's a lot of nerves, or the neck or the groin, there's a lot of blood vessels that has to go pass through there. So yeah, it's just, those are the things that we looked at, rather than, okay, I need to fix this muscle and make this loose. If you keep treating same quads over and over again, that will tell you, okay, I've been treating this muscle for quite some time now. It's not letting go. That's a time to okay, maybe you need kind of an osteo treatment to see where is that connected. What's the insertion of that muscle? What's wrong with the insertions of that muscle? And then if you still can't find that area, what are the upper chain problems or the lower chain problems, right? So it's kind of things.
That's amazing. I'm so glad that you have that ability to help people in a different way once they've seen you for massage. But I also know that you've grown not only your osteopathy, but you've grown your acupuncture services as well. Can you tell me about that? Yeah,
so we have 2 doctors of acupuncture, and they're amazing with what they do. Actually, 4 days ago, I just came in for a maintenance thing, and I just she asked me, okay, any other symptoms? I remember that I have a little bit of a little bit sticky shoulder. And then I was on my back, treating on the front. And then, okay, I'm just gonna, because she can't do the back, so then she had to needle a little bit of a distal points and some points that I never know. But then it came up oh yeah, my shoulder's just moving. That's the magic of those needles. There's definitely some magic in there, because she didn't have to massage or manually treat the shoulder, but then it came out with oh, okay, my shoulder is moving.
That's amazing.
You're just kind of amazed with what different modality and treatments too. It's like, it's just, and I would say you cannot just replace things. You just complement these treatments
Right.
with each other, because it taps differently with clients, right?
Yeah, I love that. I also know that both of the doctors of acupuncture that you have very different practices from each other. So you can offer an extremely wide variety of different types of acupuncture. I know that Desiree, she does the electroacupuncture with me, which I'm in love with.
Yeah.
What are some of the other acupuncture services?
They're both of them have, like, of course, the acupuncture, but they have different modalities that they offer. Desiree does the moxibustion and the electro. Forgot that term. So those ones that the
electroacupuncture,
that one. And there's a lot of like the tools that she used to more with like soft tissue releases and stuff like that. So that's amazing. And then for Dr. Natalie, she does a lot of different things as well. She even add like energy clearing to her practice recently. So that's good. So she does microneedling, like facial rejuvenation.
I know that you're also always looking for ways to add little different touches to the services that you offer. One of them is one of my favorite things that is in the massages that I get. It's the hot towels.
Oh, yeah. Yeah. So we have, when we started in this location in 2024, July 2024, we don't have the warm towel warmers until one therapist like, can I bring my kind of own towel warmer? I was like, realized like, hey, some clients will be jealous. It's like, I had to find something. So I found something that like just big enough to fit in those cubic IKEA thing. And that's been working. Everyone just using them, and clients just like, oh, amazing.
It is amazing.
Nice. Yeah. I was like, oh, this is so good. This is so nice. Just on my neck. Oh, please. Yeah. So it's really nice.
In addition to the warm towels, what are some add-ons that some clients can expect or add on to their massage?
Oh, yeah. So, in addition to our regular, like everyone know the deep tissue relaxation therapeutic massage, prenatal, postnatal massage, lymphatic drainage, you can have their massages. And there's the hot stone is definitely, one of clients' favorite. And then cupping, myofascial cupping massage. And then, someone does massage with thighs. So just a lot of like stretches and stuff.
Ooh.
And then massage with reflexology. So I just had that too. I tried it too. It's like, oh my gosh. It's like, it hurts, but it's so good, And then, so we have massage with Reiki. There's a lot of things. And then one recent addition was the massage with scalp massage with coconut oil. And that has been like, popular.
I'm not surprised that it's popular. Everyone loves a good scalp massage.
Yeah, and it's like a 15-minute just on the scalp. Like, who doesn't want that? Yeah, and then Kelly also offers like a paraffin wax for the hands for now.
Okay.
So they can ask for that. So for Kelly, does offer that.
Wonderful. That's lots of add-on services. So you can get your massage therapy done, but you can also get some like nice relaxation touches.
Yes.
I love that. And what about for when people go to leave? Do you have things that can help people at home? Especially we have a nice little like stretches guide in each room. So they can have their therapist to say, what needs to be stretched or, after treating a client. But usually there's a home care, to ask. You can always ask what they can do to help, right? Maximize that treatment. Wonderful. I love that. You also you're selling something called a Tuesday. Can you explain what that is?
Yeah, so it's like a massage hook that can, like the tip of it is like a roll that we can roll on. So it kind of, so if you try and hook and move it, it doesn't, your clothes stays there. Because some of the massage tool, when you move the hook, your clothes go with it.
Right.
So this one, it doesn't, because there's a roll kind of rolling thing in the end, so you can move it around and find trigger points on your back, and then you can, like hook it and treat it, self kind of treatment at home between sessions. So
Wonderful.
That's really good.
I know that I really like to make sure that I'm trying to keep myself in as good a order before my next massage. So I really enjoy that.
Yeah. So that's.
And I know at the front, when people are coming or going, you've got a display wall that has things like sprays and Epsom salts. Can you talk a little bit about that, what you've got for sale there? Yeah,
so at first we just have like essential oils, and I started with like MSM Mercy lotion or Mercy spray, which they've been popular for arthritis and stuff like that.
Oh, great.
And muscle pain and spasm. It's been great with helping clients with their pain when they're home, and then when they're at home. And then recently we just added because we have a lot of requests for magnesium spray, so we're able to sell that as well. And it's been actually good. At one point because I had a client that had a kind of attack of like spasm and kind of Charlie horse, and he can't move, so he keep moving like, okay, this is not good. No. And I'm like, okay, wait, I can try the magnesium spray on you. So I took the spray from there and the tester and just tested on his muscle within like not even 30 seconds.
Wow.
Or definitely just a quick seconds. It's like, okay, it's gone. Okay, we can move on, because we couldn't move on with the treatment because he's definitely spasming there, right? Like the muscle is just like mad. So the quick magnesium spray did definitely help.
Excellent. So if clients are having spasms, you recommend picking up a bottle of the spray?
Yeah, so, for restless leg syndrome and muscle, because magnesium can help with the muscle to relax.
Wonderful. Anything else going on in the clinic? I know it's been a little bit since we sat down and got a whole clinic update, so I want to make sure I include everything. Yeah, so everything's doing well. Everyone just kind of happy to work with each other. Always here at the back, talking about, what do you think of this? What do you think of this client? How can I, if you get stuck with clients, you can see like, okay, dealing with this client, I don't know how else can I help this. Do you have any idea? Like, what would you do? Right.
It's so good to be working with, in the setting where there's help, because I used to work by myself.
Yeah.
It's over a year, but it's just sad. And then like, okay, if I get stuck, like who would I ask? Like, you're not perfect. You're just practicing. That's why, and it definitely made a huge difference to have someone in a clinic setting, when you have someone to ask, okay, what would you do with this? I've never had this type of, client like this. So it's very good to ask those questions, or say like, oh yeah, book with me for this. I can help with that kind of thing, right? So it's not, and then what is really good is we're not like, like that client is mine. It's like we wanted to show the client, okay, I think you can help this client that I saw today with something this, because you're good at this. So I'm gonna tell them to see you. It's about, because we care about the client so much that we don't want to like, hey, that's you're mine.
Right.
No, it's not like that. You just wanted to help the client with whoever they see.
Right.
They're in good hands.
I love that. Such a spirit of cooperation and just wanting to heal the client.
Yeah.
That's great. So if people want to come and see you, Lianna, where do they go? What do they do?
Yeah, so we are located at 975 St. Albert Trail in St. Albert, close to Costco. And then, yeah, so they can always check our website at healingpointmassage.ca, and then to book online, and they can always call 780-569-3838, and we'll be happy to assist you with those that I mentioned that we can do.
Perfect. Yeah, I love coming to Healing Point Massage Therapy. I make sure that I get there a little bit early. There's a beautiful fireplace and free coffee and tea. Yeah. So get there early, relax, sip, enjoy the fireplace. And then when your therapists are ready to see you, they will take you in and work their magic. Yeah. Well, thank you so much for coming in and explaining to me all of the new things that are going on at Healing Point.
Thank you. Thanks for today.
Yeah. See you next time. And if you like this video, hit like, leave any comments below. We'll address it in a future video, and send this to someone who needs to relax or to heal their body.
Bye.